Hey guys, welcome to my YouTube channel. Bokamoso Mthimkulu here. So over the past few weeks, I have discussed different health conditions known as cardiovascular risk factors. Now, what cardiovascular risk factors have in common is that they can lead to the development of cardiovascular diseases, which includes heart diseases as well as stroke. So the more conditions you have or risk factors you have, the higher your chances are of developing a cardiovascular disease. What I want to do today is tell you what the risk factors are as well as their defining criteria so that you can work out your risk status yourself. Guys, please do share this video if you think there's someone out there that will benefit from working out their risk, as well as subscribe to my channel if you want to see more videos like this. First, we have age. Age is a non-modifiable risk factor, which means that you can't really change it. So if you are with over a specific age, then your chances are inevitably increased. So for males, if you are over the age of 44, and for females, if you are over the age of 54, then your chances of developing a cardiovascular disease is increased. Next, we have family history. Family history is another non-modifiable factor. So if there has been a record in the family of heart attack, sudden death, or coronary revascularization in a father or first degree male relative younger than the age of 55, or a mother or first degree female relative younger than the age of 65, then your chances are increased. Next, we have cigarette smoking. This is a modifiable factor, which means that it can be changed. So if you currently smoke or quit in the last 6 months, or are exposed to environmental tobacco smoke, such as in the situations of secondhand smoking, then your chances for cardiovascular diseases is increased. Next, we have sedentary lifestyle as a risk factor. If you do not participate in at least 30 minutes of moderate intensity physical activity on at least 3 days of the week for at least 3 months, then your chances for developing cardiovascular diseases is increased. Activities that are classified as moderate include a brisk walk, jogging, swimming, cycling, etc. The next risk factor is obesity. If you have a body mass index that is greater than 29.9 kilograms per meter squared, or a waist circumference that is greater than 102 centimeters for men and 88 centimeters for women, then your chances for developing a cardiovascular disease is increased. Please do view this video on how to measure your BMI as well as your waist circumference if you wish to do so yourself. Dyslipidemia is the next risk factor. If your low density lipoprotein cholesterol or your bad cholesterol is greater than or equal to 3.37 millimoles per liter, or your high density lipoprotein cholesterol or good cholesterol is less than 1.04 millimoles per liter, or you are on lipid lowering medication, your chances for developing a cardiovascular disease is increased. But if you cannot check your blood levels of low density lipoprotein as well as high density lipoprotein and can only check your total blood cholesterol levels, that is fine. So if your total blood cholesterol levels is greater than or equal to 5.18 millimoles per liter, then your chances are also increased. Next, we have hypertension, which is high blood pressure. So if the top value, which is your systolic value, is greater than 139 millimeters of mercury and or your bottom value, which is your diastolic value, is greater than 89 millimeters of mercury, and you test on 2 separate occasions and it is high, then your chances are increased. But if you are on antihypertensive medication as well, then your chances are also increased. Lastly, we have pre-diabetes. So pre-diabetes is a state where your blood glucose levels is above normal but not high enough to be classified as diabetic. If you have an impaired plasma fasting glucose level, which is greater than or equal to 5.5 millimoles per liter, or an impaired oral glucose tolerance test result, which is between 7.7 millimoles per liter and 11 millimoles per liter, then your chances are increased. But you have to test on 2 separate occasions, and it has to fall within those values on those 2 separate occasions for your chances to be increased. But there is a negative risk. So if your high density lipoprotein cholesterol, which is your good cholesterol, is greater than 1.55 millimoles per liter, then you have a negative risk for cardiovascular diseases. So with all these risks added together, if you have more than 2 risk factors, then you add a moderate risk for developing cardiovascular diseases. And if you have less than 2 risk factors, then you add a low risk. So your aim is to try and keep it at a low risk. Guys, if you did enjoy this video, please do give it a like and share it with people who you think will benefit from hearing about this. Also, subscribe to my channel if you want to learn more about different health conditions and how they affect the body. Hope you guys do have a great week. Bye.